Welcome back to Morning Break and today's Monday Motivations. We have Dr. Randall Gates, board-certified chiropractic neurologist and chiropractic physician, here to talk about winter sports and concussions. It is the time of the year when both of those tend to go hand in hand, and so we're really going to dive into what that means and all of that stuff. So let's start us off. Tell us a little bit about what are some of the concussions that people can face during winter sports.
Well, being in this area, as we know, a lot of people like to go up to the slopes. We're getting snow, which is wonderful. This time of year, I see so many more concussions than other times of the year. It's very seasonal, not entirely, but it is seasonal. And so many people, you know, hit their head. They may get knocked out, they may not. They oftentimes go to the hospital to get evaluated, which is good, because the main concern with a head injury is a brain bleed.
Yeah.
And if that's ruled out, then I kind of wanted to take, you know, everyone through other options.
Yeah. So that kind of initial hospital visit, that's just standard protocol. You hit your head. If you've got any concerns, you go to the hospital, they rule out brain bleed, and then they just kind of send you on your way.
Lots of times,
but there's a lot more that could be going on inside the brain, and that's where you can come in. And you've got a couple of different scans that we want to talk about. And so we've got something that you call is just your standard MRI scan. So if we can show that, and then we'll go into the diffusion tensor imaging scan. So this one first, what is this one showing
So the
us?
one on top in the gray and white matter is your standard MRI scan. Now, most of the time in an ER, you're going to get a CT scan.
Okay.
But if that's normal and a person is still having symptoms, lots of times doctors will order a brain MRI that looks like that.
Okay, and then what is this diffusion tensor imaging?
And then on the bottom, you see DTI, as we call it. So diffusion tensor imaging tells us if there is damage basically to the white matter tracts of the brain.
And what does white matter do?
Well, white matter is kind of like the wires of the brain. And so frequently, the standard gray and white matter image will be normal, often with concussions as well, and the vast majority of the time. However, when we do DTI, that's where we see the damage in the brain, and we can actually show the patient, you have effect here, you have effect there, and then we can use it as a marker for progress and healing as well.
So when somebody, let's say somebody's skiing or snowboarding and they hit their head, they go to the ER, they get the yes, you got a concussion, go home and kind of, do your standard procedure of care, but then they still are experiencing symptoms. How long can they be experiencing symptoms that would like maybe warrant a visit to you to really say, okay, something worse is going on rather than just standard post-concussion injury?
Yeah, usually if something is protracting past 30 days, then we get really concerned. Yeah.
Okay,
yeah,
that can happen.
They're going into post-concussion syndrome.
Okay, post-concussion syndrome. I didn't even know that was a thing.
Oh, you didn't?
No,
oh, yeah. Yeah, so post-concussion syndrome is a very legitimate entity. It's for those who suffer head injuries and where the symptoms become chronic. And that's been a big passion of mine. That was a big reason to bring imaging like this to Reno. And for the audience who hasn't been watching, that imaging is done at Advanced Imaging Reno. If you want to get that done, you have to get a referral from your doctor, and you can call 775-507-3331. And then I'm also with Gates Brain Health, even though I have a proprietary interest in Advanced Imaging Reno. With Gates Brain Health, we serve those who have concussions who are not getting better.
Okay.
And so that's where we do an in-depth evaluation. We do video recorded eye movement testing, which is actually the gold standard in concussion work, a lot of nutritional work and brain exercises because something was damaged in the brain and it needs to be rehabilitated.
Okay, and so some of those like, post-concussion injuries and stuff like that, is those things like headaches, dizziness, those are the first two that come to my mind. Is
you're
there
right.
anything else?
Yeah, headaches, dizziness, fatigue is a really big one, trouble concentrating, trying to concentrate and developing those symptoms. There's a whole litany of symptoms that can go along. Pretty much any neurological symptom can be associated with post-concussion syndrome, but headaches and dizziness are the common ones.
And what about like age factors into it? You know, you got everybody, different ages sliding down the slope, right? And so from kids to, your prime adult age and to the elderly, what kind of changes does that recommend for as far as procedure of care?
I'm with you. So kids tend to heal a little faster, but they certainly are susceptible to concussions. The elderly are definitely susceptible as well. A lot of it deals with neck muscle mass.
Okay.
So those who have a more muscular neck, like you think of the football players, if most of us took one of those head hits that they do on one play, we would have a concussion. And they do it all the time. They have subconcussive head impacts, but the neck musculature really helps to brace for the effects of a concussion.
Okay, good to know. Well, we certainly appreciate it. It is so important to stay safe out there as you guys are having a lot of fun going down the slopes. Certainly a wonderful time. I was also thinking ice skating. You know, knowing my luck, if I tried ice skating, I would definitely land straight on my butt and hit my head. So whatever you're doing this holiday season, even if it's just, you know, walking on an icy sidewalk, please be careful out there. And if anything happens, of course, go and see your doctor. So Dr. Gates, thank you so much for being here. We appreciate it.
Yeah.
Thank
Thanks,
you.
Katie.
And thank you guys for watching. We'll be right back.